Thank you so much for joining me today to learn what's new to Medicare for 2023. My name is Melissa Devine. I am the Site Coordinator for the Medicare Medicaid Assistance Program through the Area Agency on Aging 1B. Let's get started. Today, we will discuss what Medicare is, what's new to Medicare for 2023, why you should review your plans each year, and what to look for when choosing a plan. We're also going to review who MAP is and how MAP can help you understand your plan choices and potentially save you some money. So what is Medicare? Well, Medicare is insurance for three groups of people: those aged 65 or older, those under 65 with certain disabilities, and those of any age with end-stage renal disease. Medicare has four parts to it: Part A, hospital coverage; Part B, medical coverage; Part D, prescription drug coverage; and Part C, Medicare Advantage plans. Medicare Advantage plans are typically the combination of A, B, and D into one plan, which is an HMO or PPO, and they may offer extra benefits, like dental, vision, and hearing. Enrollment, though, typically takes place through Social Security for most and the Railroad Retiree Board for railroad retirees into Medicare Part A and B. And if you're receiving Social Security or railroad retiree benefits, enrollment may be automatic. However, if it's not, then you'll have to enroll into Medicare Part A and B during your 7-month initial enrollment period. Once you enroll in Medicare Parts A and B, you will not need to re-enroll in Medicare Parts A and B each year. What you'd want to review each year is going to be your prescription drug coverage or Medicare Advantage plan. When you first enroll into Medicare, and of course during certain times of the year, you can choose how to get your coverage. The two main ways to get coverage are: first, Original Medicare, which includes Parts A for the hospital insurance and Part B for the medical insurance. Then you'll want to take a drug plan for your prescription drug coverage, which you'll have to join separately. And to help pay your out-of-pocket costs in Original Medicare, like your 20% coinsurance, you can also shop for and buy a supplemental plan or a Medigap policy. These can be used at any doctor or hospital that takes Medicare anywhere in the U.S. Now, if you choose to go the second route, which is Medicare Advantage, this is also known as Part C, the Medicare Advantage plan is going to be an all-in-one alternative to Original Medicare. These bundled plans include Part A, Part B, and usually Part D coverage. These plans may have lower out-of-pocket costs than Original Medicare, but in many cases, you'll have to use their doctors that are in their plan's network. Most of these plans are offering extra benefits that Original Medicare doesn't cover, like dental, vision, hearing, and more. Now let's take a look at some of the Original Medicare updates. The Medicare Part A deductible that beneficiaries will pay when admitted to the hospital is $1,600 for 2023. The Part A deductible covers beneficiaries' share of costs for the first 60 days of a Medicare-covered inpatient hospital care in a benefit period. Beneficiaries must pay an additional $400 per day for days 61 to 90 and $800 per day for hospital stays beyond the 90th day. For any beneficiaries that are in a skilled nursing facility due to hospital admission, the daily coinsurances for days 21 through 100 in a benefit period is $200. For the small number of beneficiaries who have to pay a Medicare Part A monthly premium, their bill can be up to $506. Medicare Part A covers inpatient hospital, skilled nursing facility, and some home health care services. Although about 99% of Medicare beneficiaries do not have to pay a Part A premium because they have worked 40 quarters of a Medicare-covered employment, enrollees age 65 and over, and certain persons with disabilities who have fewer than 30 quarters of coverage must pay a monthly premium in order to receive coverage under Part A. The Part B monthly premium for 2023 is $164.90. That's a decrease, which we are very happy to see. and the annual deductible for Part B is $226. Now, this is just a quick look at what unlimited medical auto coverage will cover versus Medicare. With the recent auto reform that we had a couple of years ago, there's the option to elect for your Medicare coverage to cover the unlimited medical auto aspect. And we just want to show you side by side what each covers so that when you make your decision, you can make it effectively and confidently with all the necessary information. So the biggest things to note are that while you do have similar coverages with emergency room, hospitalization, skilled nursing facility care, and even some home health services, when it comes to long-term care and custodial care, Medicare does not cover that. That is something that the unlimited medical auto coverage will cover. Likewise, Medicare does not cover guardianship or conservatorship, transportation services for medical non-emergency purposes, massage therapy, vehicle modifications, alternative pain management, and even wage losses if you were still working when the auto incident took place. So as you're making your determination on whether you'd like to keep your unlimited medical auto coverage or have the Medicare cover that, make sure to look at what each of these details are to make that decision. If you have a health savings account with a high deductible health plan based on you or your spouse's current employment, you may be eligible for a special enrollment period to sign up for Part B without penalty. However, when it comes to Medicare Part A, in order to avoid any tax penalties, you and your employer should stop contributing to your HSA at least 6 months before you apply for Medicare. This is because your Part A coverage will start up to 6 months back from the date you signed up for Medicare or apply for benefits from Social Security or the Railroad Retirement Board. And you're not eligible to make contributions to your HSA after you have Medicare. If your Medicare Part A coverage overlaps when you made contributions, you will have to pay a tax penalty. Now, you can withdraw the money from your HSA after your Medicare coverage starts to help pay your share of costs like deductibles, premiums, coinsurances, and copayments. Speak with your HR benefits coordinator or tax professional for more information. If you're still employed when you first are eligible for Medicare, you'll want to speak with your HR benefit coordinator for answers on delaying enrollment into Medicare Part B. Is your employer plan considered credible coverage? Is the employer plan primary or secondary to Medicare? If the employer plan is secondary to Medicare and you delay the enrollment into Medicare Part B, you could end up with a late enrollment penalty and a lapse in coverage. So make it a point to speak with your HR benefit coordinator for more on this. Now to our biggest ticket item for 2023. It's the Inflation Reduction Act of 2022. This was signed into law by President Biden on August 16, 2022, including several provisions like creation of a 15% corporate minimum tax rate, energy security and climate change investments, the Affordable Care Act subsidy extension, the IRS tax enforcement, and the Medicare prescription drug price reform. This legislation has taken shape amidst strong bipartisan public support for the government to address the high and rising drug prices. CBO estimates that the drug pricing provisions in the reconciliation bill will reduce the federal deficit by $237 billion over the course of 10 years. But this prescription drug proposal includes so many items under the Inflation Reduction Act, like negotiating prices for some medications that are covered under Medicare Part B and D, requiring drug companies to pay rebates to Medicare if prices rise faster than inflation, to cap out-of-pocket spending for Medicare Part D enrollees, and make other Part D benefit design changes, to limit cost sharing for insulin to $35 for people with Medicare, to eliminate cost sharing for adult vaccinations covered under Medicare Part D, and improve access to adult vaccines in Medicaid, expanding eligibility for full benefits under Medicare Part D's low-income subsidy program, This is just a brief summary of these provisions. We're going to discuss the expected effects on those who will see these changes take effect in just a few slides. But before we can get into the nitty-gritty of the Inflation Reduction Act and how it affects Medicare Part D, let's take a look first at what the issues are with Medicare prescription drug coverage prior to the Inflation Reduction Act. Medicare's share of the nation's retail prescription drug spending has increased from 18% in 2006 to 30% in 2017. The prescription drugs covered under both Part B and D accounted for 19% of all of Medicare spending in 2016, and 10 drugs accounted for 17% of Part D spending in 2016, including both Medicare and out-of-pocket spending. So after a period of relatively slow growth, Medicare Part D spending per enrollee is projected to increase at a faster rate in the coming decade. Spending for catastrophic coverage or reinsurance has increased as a share of total Medicare Part D spending from 14% to 40%. Prescription drugs accounted for $1 in every 5 that Medicare beneficiaries spent out of pocket on healthcare services in 2016, not including premiums. So Medicare Part D enrollees who did not receive low-income subsidies spent about $500 out of pocket on their prescriptions in 2016 on average. But 1 million enrollees with spending above the catastrophic threshold spent nearly $3,200 out of pocket. The average Part D enrollees out-of-pocket spending in the catastrophic phase dropped in 2011 due to the Affordable Care Act provision to phase out the coverage gap. But costs for this group are on the rise as total drug cost spending grows. Medicare Part D enrollees can pay thousands of dollars out of pocket for specialty tier drugs, and most costs for many specialty drugs occurring in the catastrophic phase of the benefit. Overall, Part D is just becoming way too costly, and it's presenting a position where Medicare beneficiaries are having to choose between medications and other important items in life, like housing and food and even clothing. So, with the higher Part D premiums, the higher Part D copayments, the higher Part B premiums, and the faster depletion of the Medicare Trust Fund, 29% in the last year have not even taken prescription medications because of the cost. 26% find it difficult to afford prescription drugs. Well, the Inflation Reduction Act of 2022 is here to help with some of that. Again, this Inflation Reduction Act regarding the Medicare prescription drug provisions is going to require the federal government to negotiate prices for some of the most popular medications under Medicare. It's going to require drug companies to pay rebates if their prices rise faster than inflation for their medications used by the Medicare beneficiaries. It's going to eliminate 5% coinsurances for catastrophic coverage in Part D. It's going to add a $2,000 cap on Part D out-of-pocket spending, limit annual increases in Part D premiums for a limited time, limit monthly cost sharing for insulin to $35. It's going to expand eligibility for extra help or the low-income subsidy, LIS, and eliminate cost sharing for adults' vaccines under Part D, and delay implementation of the Trump administration drug rebate rule. So if you look at everything on a timeline, the first things that you'll see take place in 2023 is that drug companies are going to start paying the rebates back. We're going to see that insulin cap of $35, and we're going to see that vaccination copay reduction. As you look forward to 2024, it's going to be the part where they're going to eliminate the 5% coinsurance and that catastrophic level and expand that LIS eligibility. In 2025, that's where we're going to see the $2,000 out-of-pocket cap in Part D. And 2026 and beyond is where we're going to see the negotiation of medications, whether Part D or Part B and D. So, for those things that are taking effect right away in 2023, let's take a deeper look. Requiring drug manufacturers to pay rebates for the drug price increases above inflation is expected to limit the out-of-pocket drug spending growth for people with Medicare. It's going to discourage drug companies from increasing their prices faster than inflation. Manufacturers will be required to pay the difference in the form of a rebate to Medicare, and the rebate dollars will be deposited into the Medicare Supplementary Medical Insurance Trust Fund. The Part D inflation rebate provision takes effect in 2022, the starting point for measuring drug price increases with rebate payments required beginning in 2023. The Part B inflation rebate provision does take effect in 2023 as well. For Medicare beneficiaries with diabetes who use insulin, coverage is typically provided under Medicare Part D, the outpatient prescription drug benefit. It may also be covered under Part B when used with an external insulin pump. Because Part D plans vary in terms of insulin products that they cover and the cost per prescription, what enrollees are going to pay for insulin products may also vary. The beneficiary coinsurance under Medicare Part B is 20% of the Medicare approved amount. Currently, Medicare beneficiaries can choose to enroll in a Part D plan, participating in an innovation center model in which enhanced drug plans cover insulin products at a monthly copayment of $35 in the deductible, initial coverage, and coverage gap phases of the Part D benefit. Participating plans do not have to cover all insulin products at the $35 monthly copayment amount, just one of each dosage of form, like vial or pen, and insulin type, rapid acting, short acting, intermediate acting, and long acting. Well, the Inflation Reduction Act is going to limit the monthly cost sharing for insulin products no more than $35 for Medicare beneficiaries, including insulin covered under both Part D and Part B, and no deductible will apply. This limit is going to take effect for Part D, January 1st, 2023, and Part B, July of 2023. The $35 cap on monthly cost sharing for insulin products is expected to lower the out-of-pocket costs for insulin users in Part D without low-income subsidies. Please note that because the Inflation Reduction Act was passed in August of 2022, this is after the plans had submitted their annual plan bid packages for plan data to display on the Medicare Plan Finder. So, what's displayed on the Medicare Plan Finder won't necessarily reflect the Insulin Reduction Act insulin cost sharing cap, but we will be able to utilize the website to show what insulin the plans will cover at that $35 cost sharing cap, and can discuss those financial aspects with you a little further if you're to do a one-on-one MAP counseling appointment. Again, this $35 cap is going to be per insulin, so if you do take more than one, it is going to be $35 per insulin that is covered by the Part D plan. And this is just based off the plan's formulary, not like it was with the plan model from last year. The Inflation Reduction Act also requires that adult vaccines covered under Medicare Part D that are recommended by the Advisory Committee on Immunization Practices, such as shingles, will be covered at no cost. This makes coverage of vaccines under Part D consistent with coverage of vaccines under Part B, like the flu and the COVID-19 vaccines. The law is also requiring state Medicaid and CHIP programs to cover all approved adult vaccines recommended by the Advisory Committee of Immunization Practices and the Vaccine Administration without cost sharing. Eliminating this cost sharing for adult vaccines under Medicare Part D could help with the vaccine uptake among older adults and lower out-of-pocket costs for those who need Part D coverage vaccines. Now let's take a look at the Medigap updates. Medigap plans are available to purchase if you enroll in Medicare and take original Medicare Part A and B. Medigap plans help pay the coverage gaps with original Medicare Parts A and B copays and coinsurances. And there are even some select plans available to Medicare beneficiaries under 65 with disability. But some Medigap plan providers are now offering extra benefits like dental, vision, hearing, even gym memberships. And these programs are available to purchase with the policy or are listed as a discount program provided by the Medigap plan. For more information, contact the different plan providers to see what they're willing to offer. Now let's take a look at the Medicare prescription drug benefit updates. If you do not have creditable drug coverage and you do not enroll in Part D when you're eligible, you will pay a late enrollment penalty when you choose to sign up for it. This penalty will be added onto your monthly premium and it will continue with you the entire time that you have Part D coverage. Late enrollment penalty is calculated by taking 1% of the Part D base beneficiary premium for every month that you did not have creditable coverage and did not enroll in Part D. For 2023, that Part D base beneficiary premium is $32.74. Now, the penalty amount changes each year as the Part D base beneficiary premium changes. So it has the potential for going up each year. And again, the late enrollment penalty will stay with you for life. Beneficiaries with significant income will pay a sliding scale higher Part D premium based on IRS tax returns from 2 years prior. There are 6 income categories, and each category has a set dollar amount. Let's take a look on the next slide at that 6 income category. These are the 2023 IRMA numbers. The income thresholds will be adjusted each year by increasing the previous year's income threshold amounts by the Consumer Price Index for urban customers. For those that are individual tax filers with an income over $97,000, and for those that are joint tax filers with an income over $194,000, you can see that there will be an additional amount tacked onto your monthly premium for Part D. For those in that category would be $12.20 added onto your monthly Part D premium and will continue to go up as the income amounts go up. Now again, this is based off of 2 years prior for your IRS tax return. So if you've had a change in life circumstance, you'll want to connect with MMAP so that we can help you inform Social Security of that change and potentially reduce or remove this IRMA amount that gets tacked onto your monthly premium. This is a look at the standard Medicare Part D basic benefit structure. For those who enroll in a prescription drug plan that has a deductible, you would first enter the deductible phase for 2023. This is where you're going to pay the full negotiated cost for your drugs up to $505, which is the maximum annual deductible for 2023. Once that deductible amount is met, you then pay your set copays or coinsurances for your drugs, and you will pay your negotiated copays or coinsurances for your drugs until you've paid $4,660 in total drug costs. Now that total drug cost can include what you have paid and what the plan has paid towards your covered drugs. Once you've paid $4,660 in total drug costs, you enter into the coverage gap. This is where you're responsible for 25% of the cost of your drugs until you've paid the $7,400 true out-of-pocket or billed the insurance $11,206 in retail cost. Once you've paid the $7,400 true out-of-pocket or billed the insurance $11,206 in full retail cost, you'll enter the catastrophic phase. In the catastrophic phase, this is where you're responsible for 5% of the cost of your drugs. Again, that coverage gap used to be referred to as the donut hole, but for 2023, that coverage gap has been closed, still remains closed, and you're responsible for 25% of the cost of your generic medications and 25% of the cost of your brand medications in that coverage gap phase. Now, please note that if you or anyone you know is on the LIS Extra Help benefit, those beneficiaries with LIS and Extra Help do not have the gap in coverage, so they won't see a change in their benefit structure. These beneficiaries just continue to pay their standard LIS Extra Help copayment amounts throughout the year until they reach the catastrophic level. And that LIS Extra Help benefit, that's a subsidy that's provided by Social Security's administration, but it helps with the cost for the Part D prescription drug coverage, including the monthly premiums, deductibles, and copays. Guidelines do change each year at the beginning of the year because it is an income and asset-driven subsidy program. But for 2023, if you have LIS or Extra Help, it will help cover the monthly premium cost for plans that are $32.65 and under. So for more information on whether your plan would constitute meeting that $32.65 and under, speak with a MAP counselor for more information. So while there is unfortunately no continuous open enrollment period for Part D, most beneficiaries have limited timeframes to make an enrollment, to disenroll, or even switch their Part D plans. These 3 enrollment period categories include the initial enrollment period, the annual open enrollment period, and special enrollment periods. So there are some circumstances in which people with Medicare are given a special enrollment period. This would be like an involuntary loss, reduction, or non-notification of creditable coverage, entering, residing in, or leaving a long-term care facility, moving out of the planned service area, and other exceptional circumstances. However, if you're not sure if you meet any of these special enrollment periods, it's important that you reach out to MAP. We can go ahead and look at your situation with you and help determine whether you have a special enrollment period to make enrollment changes. An important note too about COBRA, while COBRA is not considered creditable coverage for Medicare Part B, the drug coverage may qualify as a special enrollment period into Part D. So again, many different rules for different reasons, that it's really important that you let MAP help you determine what you qualify for. Open enrollment period is also known as the annual election period. If a beneficiary does not qualify for a special enrollment period and wants to disenroll from a Part D or Medicare Advantage plan, they can enroll in a new plan during the open enrollment period. Any enrollment changes that occur during this time will automatically disenroll the beneficiary from their previous plan, with their new coverage becoming effective January 1st the following year. So open enrollment this year, any changes that you make in the fall are going to become effective January 1st of 2023. Open enrollment period is always October 15th through December 7th each year. Now you may hear MAP refer to a system called Medicare's Plan Finder. Medicare's Plan Finder is a one-stop shop for all things Medicare. It's located online at medicare.gov and allows you to create a personalized account. With your personalized account, you have access to all things Medicare, like your Medicare summary notices. You can pay a Medicare Part B premium if you're not receiving retirement benefits or disability benefits. You can personalize plan information tailored to your needs and more. This is what we use with MAP. We use this to help you find the right plan for you. And while we at MAP highly encourage you to create a login with Medicare's Plan Finder, we do understand that it may not be the preference for everyone. If you're still wanting to do an anonymous search and you'd still like to speak with a MAP counselor, call MAP at 800-803-7174 to schedule an appointment with somebody today. Medicare uses a star rating on their Plan Finder, and this is to measure how well Medicare Advantage plans and Part D plans are performing. Medicare scores how well plans perform in several categories, including quality of care and customer service. These ratings range from 1 to 5 stars, with 5 being the highest and 1 being the lowest. Plans are rated in each individual category, and Medicare also assigns plans 1 overall star rating to summarize the plan's performance as a whole. The beneficiary can use this overall star rating to compare performance among several different plans. Medicare reviews plan performance yearly and releases new star ratings each fall. This means plan ratings may change from year to year. So remember, before considering a plan star rating, make sure that the plan's coverage and cost suit your needs first. And in an effort to promote better plan quality and better choice, Medicare sends notices to those who are in Part D plans or Medicare Advantage plans that fail to get at least a 3-star quality rating for 3 straight years. This notice lets you know about a special enrollment period to enroll in a 4 or 5-star plan. We'll share more information about this special enrollment period as it's made available. Now, this is a look at the Medicare fall timeline. By October 1st, 2023 Part D and Medicare Advantage plan information is available on Medicare.gov. Plans will begin marketing, so be sure to check your mailbox. And of course, the annual notice of change for the current coverage that you have under Medicare will be sent to you, and the Medicare New Book will also have been sent to you. By October 10th, we see the star quality ratings released on Medicare's Plan Finder, and October 15th is when open enrollment starts. At this point, October 15th is when you can begin to make enrollment changes, with those changes taking effect January 1st. An annual notice of change. You should have received your current Medicare's plan annual notice of change in September. If you haven't received it, look for an envelope from your insurance provider and note that it may be on thinner paper. But these are important because they show you any premium, deductible, and co-payment changes, if your medications are still covered, if they are, at what tier, and if there's restrictions on your medications. This all could lead to whether or not there could be a better plan out there for you. Now, there have been some changes to the Medicare New Book regarding what's new for 2023. So while Medicare continues to cover coronavirus disease, vaccines, tests, and other booster shots, there's also some new changes like new start dates for your Medicare coverage. Beginning January 1st, 2023, when you sign up for Medicare, the month you turn 65 or during the last 3 months of your initial enrollment period, or during the general enrollment period, your coverage will start the first day of the month after you sign up. There's also some changes regarding kidney transplants and immunosuppressive drug coverage. Medicare will offer a new benefit that helps continue to pay for those immunosuppressive drugs beyond the 36 months after a kidney transplant if you don't have other health coverage. For more information on that, you can see page 52 in the Medicare New Book. For help paying Medicare health and drug costs, if you have limited income, you may qualify for programs like the Extra Help Low-Income Subsidy or the Medicare Savings Program, which is a Medicaid program. All of this information can be viewed on pages 91 through 96 of the Medicare New Book. And of course, your mental health and wellness is a high priority for all of us. If you or someone you know is in crisis, call or text 988 or chat at 988lifeline.org. So some things to consider when choosing your Part D plan. The costs. You're going to want to look at the premium, the monthly deductibles, the co-payments, and of course, some important things like the Inflation Reduction Act. You're also going to want to look at the coverage. Are your drugs completely covered by the plan? If so, what tier do they fall on? That makes a difference as to the cost. Are you going to need a prior authorization or quantity limits or step therapy? Is this plan a nationwide plan that can be used for those who travel? And of course, is your pharmacy considered to be in-network? Is it the preferred pharmacy? Do they have a mail order option? There's 24 different plans to choose from in our region alone. This is a maze. Don't navigate it alone. Let MAP counselors help you. We can show you all of the specifics on these Part D plans and more. In a few slides earlier, we did discuss the Medicare Plan Finder star rating system. And again, in an effort to promote informed and better choices of high-performing plans, Medicare is disabling the online enrollment feature In the Medicare Plan Finder tool, for those that are low-performing plans, these plans have a low-performing icon, along with a message warning consumers of the plan's poorly rated performance. Any clients that are interested in enrolling will get another message letting them know that they need to call the plan directly to enroll. When considering Medicare Advantage plans, things you want to look at. Again, the cost. Is there a monthly premium? Is there any deductibles for the healthcare or the Part D coverage? What are my copays? Because now you're going to have a copay for your primary care or a specialist or x-rays or emergency care. What do those look like? Are they in budget? Are all of your medications going to be covered? What tier are they covered at? Will there need to be a prior authorization or quantity limits or step therapy on your medications? Again, wanting to look at that pharmacy, is it considered a network? Is it preferred? Is there a mail order option? Is mail order their main option? But also look at the primary care physicians and specialists. You want to know if your healthcare team is in or out of network. And if they are out of network, what does that mean? Are you willing to take new healthcare physicians and specialists, or do you want to stick with who you have? You also want to assess some of the extra benefits. While dental, vision, and hearing benefits are typically available with Medicare Advantage plans, they can generally be separate insurance riders and an added cost. So, if it's an added cost, they may have many levels of coverage that you can elect to take. You'll want to look at those a little closer as well. You'll want to look at the fitness benefits, transportation, telehealth, and more. Again, many things to think about and choose from. So why not have MAP help you? Again, there are so many plans to look at. So call MAP at 800-803-7174. We can help you make an educated choice and make sure that you feel empowered in the choice that you make for your healthcare insurance. Now, there are some Medicare Advantage plans that are offering what we call a Part B premium reduction. This is where they give back a certain amount each month to your Social Security check so that they can reduce the Medicare Part B monthly premium. Some of them range from $30 a month to upwards of $100 a month. Each plan is different. So again, very important to make sure that you take a look at the different options and the different plans. We also have Medicare Advantage plans with 5-star ratings. We're very excited about that because that means that they did phenomenal throughout the course of the past few years, and want to make sure that we highlight those on this slide for you. Now, if you have a Medicare Advantage plan effective January 1st, 2023, you have another enrollment period, January 1st through March 31st. During this time, if you're unhappy with your current Medicare Advantage plan, you can change to a different Medicare Advantage plan or switch back to original Medicare with a Part D plan. However, you must have a Medicare Advantage plan effective January 1st in order to utilize this Medicare Advantage open enrollment period. So how are you going to enroll in a Part D plan or Medicare Advantage plan? Well, first and foremost, I would highly recommend that you call MAP at 800-803-7174. Our services are free, they're confidential, and we are unbiased. We are not licensed insurance agents, so we're not looking to make a sale just to make a buck. We're here to help you. Our mission is to empower and educate you on your healthcare options so that when you make your choices, you are confident in the coverage that you're going to receive and that you're going to receive maximum coverage at the lowest cost to you. So MAP can help you make those enrollments. You can also enroll online at medicare.gov, enroll online with the plan's website, contact the company of your choice to request an application from them in the mail, or you can call 1-800-MEDICARE for assistance in enrolling over the phone. Now, in terms of marketing, there are guidelines plans have to follow. If they do not follow these guidelines, they can have consequences. So Medicare plans cannot market themselves as Medicare endorsed. They cannot solicit door to door. They cannot call people on national and state do not call lists. They cannot enroll people over the phone during solicitation calls. They cannot offer incentives or gifts that exceed $15 in value. They cannot market outside of their plan service area. They cannot cold call you, and they cannot conduct sales presentations and collect enrollment applications at health fairs. It has to be two separate events. If any of these situations happen to you or a friend, contact MAP. We are the senior Medicare patrol for the area, and we can report these plans. We want to make sure that there isn't anything happening behind the scenes that isn't right and isn't legal. So make sure to reach out to MAP if you or someone you know has experienced any of these issues. Likewise, you'll want to check for Medicare fraud and abuse. It's always present, whether it's through phone, email, mailings, billings, etc. Be aware of scams. There have been current scams with contact tracing for COVID-19 testing, and marketing of vaccines. Don't give your information out over the phone. If you don't know who you're talking to, they don't need any of that information. And if it's really important and they've called and you don't answer, they'll leave a message. And if you encounter any incidences like this, call MAP. Again, we are the Senior Medicare Patrol. We are able to report these issues and help reduce the fraud and scams. So how can a MAP counselor ultimately help you? A MAP counselor can help you understand Medicare health plans. They can compare and enroll you in Medicare Advantage coverage, compare and enroll you in a Medicare prescription drug plan if you want. We can help you identify and report Medicare and Medicaid fraud and scams, and assist you with enrollment into low-income programs like the Low-Income Subsidy and Extra Help Program and Medicaid. For resources outside of MAP, you have the Medicare and U book, which is state specific, and it should have come to you in the mail already. If you haven't received a hard copy, you can access an electronic version all year online, or give us a call at our 800 number and we can mail you a hard copy. There's also Medicare.gov, which is Medicare's plan finder and website, and of course you can always call 1-800-MEDICARE as well. However, the best resource for your local Medicare information is MAP. Our services are free and unbiased. Our certified counselors are not sales agents. We're not affiliated with private insurance companies, and we can be your best resource for all questions and concerns Medicare. There's no question that's too small or difficult, and we've saved over $2 million for beneficiaries in your area. So for any questions that you may have from attending this webinar, or for a personalized MAP appointment, give us a call, 800-803-7174. Open enrollment is upon us. It's October 15th through December 7th. Give us a call and we can assist you during your Medicare choices.